Well, here's another question for you. If you have your prostate removed for prostate cancer, then you're cured, right? I mean, how can you have prostate cancer if the prostate's been removed? Well, unfortunately, a lot of people decide to have their prostate removed primarily because they feel like it is curative. And that's not always the case. In the diagram in the book, The Decision, there's a simplistic drawing of a prostate exemplified by a circle, and then lines around it showing that it's been removed. But what if, for instance, the day before the surgery, one cell got outside the prostate? I mean, went into the seminal vesicles, or maybe just went through the capsule to be outside the prostate. Now that's simplistic, but if that occurred and the prostate were removed, then that person would not be cured. And I have to tell patients that. They'll come back after a biopsy report and say, I want my prostate removed because that way I'll know you'll be cured. And usually the wife is in agreement with that, and I've found that wives are usually a little bit more aggressive from a standpoint of surgery than their spouses. So I have to say, look, no, that's not true. It is an aggressive form of therapy. All of the cancer that's in the prostate will be removed, but it does not assure cure. Now, how do you know that? How do you know that 3 to 6 months later, if a patient were to have the prostate removed, whether they had been cured or not? Well, where the PSA is not very reliable in making the diagnosis, in other words, it sometimes can be elevated, but there's not cancer, it is very reliable in terms of recurrence. So in that patient who had their prostate removed, and then the PSA began to rise, that would imply that there's residual disease. How much residual disease and how aggressive the residual disease would be made known by the rate and change of the PSA over time. So, is having the prostate removed a good therapy for the prostate cancer? Yes. Does it assure cure? No. And the PSA is very reliable in making that determination. I hope this has been helpful. It's another caveat regarding prostate cancer. And this is John McHugh and Penelope. And little baby girl and little long fella. New additions to the little team here. Hello, little long fella.